Delighted now to be joined by Dr. Pooja Khatri. First of all, welcome.
Thank you.
Thank you very much indeed for taking the time to talk to us today.
Sure.
Now, you're Director of the Acute Stroke Program at the University of Cincinnati.
That's right.
So what are some of the main issues in your field right now?
Great question. You know, acute stroke, I think one of the things that we're dealing with is acute reperfusion therapies. We've, specifically endovascular treatment, we've had a run of trials that have not demonstrated superiority of endovascular therapy. And so we have learned a lot from those that we can't just provide it to all comers. But on the other hand, we've also learned that there are maybe subgroups that would benefit from those therapies. And that's the big challenge in the field right now, figuring out who, if and who, should get these therapies. I think the other challenge in the field is really getting just standard IV TPA out there to everyone. And I think we've made some progress in the last few years. I remember back several years ago when I couldn't think of more than a handful of sites in the country that treated over 100 patients with IV TPA per year, and now I can think of quite a few, and it's a great progress we've made, but we still have way to go.
So talk us through that. How do we make treatment and care available more broadly? Because not everybody can live close to a centre, can they?
Right, exactly. So there are layers to this. There are the ideal is the comprehensive stroke center where you have all possibilities of treatment at your fingertips. We've got the primary stroke centers, which is another way. And then we've got the stroke-ready hospitals, and I know that there are processes in place to formalize those hospitals, and I think that needs to be clearer. But these kinds of clear designations and then routing patients to the right place are key. Another place we've made big strides in is telemedicine, and it's really allowed the physician to have a broader reach.
Talk us a bit through what you're doing at this year's conference, because I know you're moderating a panel here, aren't you?
Yes, I am. I'm moderating a panel on where we go from here after the recent negative trials in endovascular therapy for acute stroke.
It's a great conference, isn't it? Because it brings together people from literally all around the world, isn't it?
Absolutely. It's a blast. It's one of those conferences where I hardly sleep, and I walk through the hall and I'm just so excited to touch base with my colleagues from all over the world, and it usually energizes me for the next year.
Well, thank you very much indeed for talking to us today. We appreciate it.
Thank you.